Hi, good morning. Right, so a bit more about my background. I'm, by training, I'm a molecular biologist and a bioinformatician, but I have about 20 years of experience in software engineering and data analytics. So that put me in a fairly good and unique position when we had a pandemic. Just happened to be in the right place at the right time, and managed to play a small role in helping the country. So let's go forward. That's working for once. Right, so I usually start by saying what did we do and why did we do it and how did we do it. I'm going to make it less technical and concentrate on other aspects of the work that we did. This is a small quote from a presentation that I gave fairly early on during the pandemic. And it really summarizes why did we do what we did. And it's really the fact that having data can materially change the outcome of an event, that whatever event it may be. The more data, the more information you have about that event, the better you can manage it. That's just a simple correlation. So the general statistics of what we did was, we created a service that at its peak served about 1.5 million users, unique users on a daily basis. It had about, at some point, if I'm not mistaken, we had about 76 million requests a day. That makes this service the single most visited service in the history of UK government online services. There aren't any other examples that I can come up with that would even be able to tolerate anywhere near this traffic, let alone provide the service. So how did we get there? It started, I don't have a pointer here, but it started from what you see at the bottom, and it gradually improved it. And towards its end, or towards the end of the pandemic, it looked something like what you see at the top, and the version in between was the version in between. So we did it through iterative improvement, but we hear a lot about iterative improvement. We don't really see it much in practice. One of the issues that I have noticed, both in the public and the private sector, to be honest, is that we tend to try to plan everything all the way to the end. That's just not going to work. That is not how you do iterative development. We hear all these catchphrases like agile development, but what does that even mean? What is the problem? Nobody talks about the problem of agile development. We did agile development in this, but we did our version of agile development, if you like. The problem with being strict about it, I mean, when you go to one of these agile presentations or workshops, the first thing they tell you is that just throw all the rules out. It's about getting things done. But then half an hour later, they give you a new set of rules to follow. So it's about not having rules unless it's the rules that we are talking about. And that is kind of the problem. If you look closely into agile development, it doesn't really it doesn't provide any room for feedback. You're supposed to iteratively develop, but where does the feedback come in? How do you take the feedback and implement the feedback? Because you don't have any room in your time frame in there. And that is a problem with Agile. So we tried to address this from different perspectives, and you'll see it. Before I go there, I'm going to give you a simple outlook, if you like, of how the data that you saw on the coronavirus dashboard and was published across the nation by different means was produced. So we started at 8 a.m. every single day for over 2 years. And I mean Christmas Day, New Year's Day, Easter, I worked every single one of those days for 2 years. At times, I worked 18 hours a day on some of those days. We got the data. We did some manual processing. Some of our analysts did manual processing and submitted those. And those got processed, pre-processed, anonymized. And then you see that Chinese wall in the middle. That is where we separated the infrastructure that was responsible for handling data that wasn't anonymized, wasn't aggregated, and the infrastructure that was responsible for publishing the data. That is one of the reasons why we never had any leaks of any type. Even if someone took complete control of our infrastructure, they would not be able to access data that wasn't anonymized. That is one of the methods that we used. I could not access this infrastructure from that one. If I can't do it, no one else can do it. How did we do that? We made it a one-way street. You could only push the data from here to there. You couldn't pull it from there. So it was a send system, not a pull system. That was one of our security measures. It was a fairly complicated and fairly tight schedule. So if one of those, so we needed approximately 26 to 28 pieces of data from different sources to be submitted on time during the day for us to be able to release something at 4 p.m. And if one of those pieces of data, some of them were not dependent on others, but some were, like you couldn't really produce deaths within 28 days of a positive test if you don't have the number of cases. If the cases have not been declared, you can't calculate the deaths based on the cases. So we needed data to be submitted for some of the subsequent calculations. And so one piece of data being delayed could have resulted in a chain reaction that delayed the whole thing. And that was very difficult to explain to people. We delegated to comms. They did a really bad job of it. I'm known in the public sector to not have a very good relationship with comms. And the reason for it is that every time we delegated something to them, they made a mess of it. Why? Because they didn't have the expertise. They were good at talking. They were good at, let's put it this way, they were good at not answering the questions. That wasn't really the intention. We didn't want to gaslight. We wanted to answer people and tell them why this is delayed so they would understand it. It would have caused a reputational damage for us if they didn't know the reason, the underlying reason. So at that point, I started to very gradually answer people on Twitter. So my identity had already been revealed to some people who were software engineers. Because I had made all of the code base for the coronavirus dashboard open source, so it still is open source. People could see who was contributing to this, and they linked that to my Twitter, and they managed to get in touch with me. But there were very few of them. I started communicating with them, answering them. They asked me questions, why this is delayed. I told them why, and so on. And that really suddenly turned into, from a couple of people, turned into a couple of dozens, turned to a couple of hundreds, a couple of thousands. Now I have 15,000 people following me on Twitter. And to the best of my knowledge, I've answered every single question that's ever been asked from me on Twitter. And I mean every single one of them. So this is an overview of the complexity of the data pipeline that we were handling. You might not be able to see it very well from there, but you will see that green section over there. That right there is what we call the SGSS data. That's England cases, just England. So to process England cases, we needed to get the data from an external source. That was the data for the entire, at individual level, not anonymized, data at individual level, and then had to be aggregated and turned into something that could be used by other pipelines for other calculations and be submitted for publication. And that's just a tiny part of the data we're talking about. And I think at some point we were processing something along the lines of 1 billion records a day. So let's get slightly away from the technical aspects and get into the design and the why. So I've made this up. It's not in any textbook. Don't look for it. In my experience, there are 3 primary pillars, if you like, to creating a successful data platform. It is to standardize what you have, make it easy to use, and document it well. These are the 3 most important things to do, again, in my opinion. So let's have a look at this. I'm going to make this interactive a little bit so you don't fall asleep. What do you think is wrong with this graph? It is not the size. The size is part of the graph. We can't change the number of people in different parts of the UK, but there is something wrong with the design of this graph. Can anyone tell me what it is? I'm going to make it slightly easier for you. Yeah. Well, that's true, but that was explained in the context. But that's really true about most of our graphs. So I'm taking England out. Again, it has nothing to do with the size that England was. You could have interactively take one out and look at the rest of them. But I'm taking England out so you can see it more clearly. The problem is not with England, let's put it that way. So England is out. You have Northern Ireland, you have Scotland, and you have Wales. Still nothing? Going to the next one. This is Northern Ireland. What color is this? What's the problem with having orange for Northern Ireland? Suddenly you all know that, right? For those of you not British, the problem with orange is associated with Sinn Féin, with Northern Ireland troubles. You don't want to use orange or green for Northern Ireland. Whatever color you use, you don't use these 2. This was in our color palette. It automatically assigned orange to Northern Ireland. We had to come up with a workaround so Northern Ireland would never get orange or green. Is that answer revealed? So, see, we need to be mindful of cultural sensitivities. Doesn't mean that we have to make impossible decisions or see everything, but we need to try to be mindful of these. And again, it's a balancing act between sensitivities and practicality. So we changed it to yellow. It's easier. It's not orange. So you can see that initially, when we published vaccinations data, the initial publication, that is the wording at the top. People vaccinated, first dose. That phrasing took us an hour and a half of discussion to come up with. You might think, well, that's nonsense. No, it's not nonsense. It was the subject of major controversy at the time. People were saying, no, they say people vaccinated, it doesn't mean, or people offered vaccination, or these people had the needle actually going inside them with the content of the vaccine released in. I mean, these were things that were going on at the time. You might not all remember it very clearly, but they were going on at the time, and we were in the center of it. So saying number of vaccinations would not have been enough. It should have been people actually vaccinated. Does that make sense? You know, if I said number of vaccinations in there, it might have been interpreted as number of vaccinations offered, number of appointments offered. That was not the meaning of this data. The meaning of the data was number of vaccinations actually given, but it should have been short. It's a heading. You don't want to write a short story in there. So again, you can see the alternatives we considered and rejected, potential issues with each of those. Now, We should always be mindful of inclusivity. But the one thing that I keep see when I look at government or other websites really, is that they turn this whole thing into a box ticking exercise. This is not about you sitting down and checking the boxes that this website meets these criteria because Her Majesty's, which is now His Majesty's government, has said so. That's not the point of accessibility. The point of accessibility is to make it easier for people who are not otherwise able to use this service to use it and benefit from it. It doesn't make those people necessarily disabled in the traditional sense of the word. It means that they would not otherwise be able to benefit from this. One of the things that we did as a result was release a simple summary of the data in both web and PDF format for people to download it. It's an overwhelming website. This website is designed to show you national statistics. It's not for everyone to look at these type of graphs. They might find it overwhelming. So you could have clicked on the simple summary, go there, read it in simple text format, and that was that. The headlines for the UK and for your local area, they were all available in PDF and simple. And by simple, I mean there were no styling in there, no images, no graphs, nothing, just simple text in there. In terms of other types of accessibility, structural hierarchy is really, really important. You can see again in this image that we have a heading, you have level 2 heading, you have level 1 heading, level 3 headings, and these make it easier for screen readers to follow a structure on the data. It's also important to appreciate that accessibility is not only for people with visual impairments. People with ADHD might find it easier to read text, or dyslexia for that matter, might find it easier to read text that's not justified towards the end. Justified text is more difficult to read. This is not something that's in any guideline, but you can find out about it. It's about people with color blindness. It's not always possible to accommodate everything, but we can try. And we can communicate with people and we can make things better. And this is about iterative development. You can make it better, but you need to take feedback from people who are actually using it instead of having 5 people who are already working on the project sit around the table and say, yeah, I think this is it. They say, no, I don't think that's it. And yeah, we come up with a solution we think is fine with us, but it would not help anyone in the real world. So it's also important to not make the service less useful for other people. Again, we don't have to make black and white decisions. It's not a zero-sum game. It can be done so we can do something that's beneficial to everyone. It doesn't have to be a disadvantage to one group and an advantage to another. And as I said, it's always a work in progress. It's sometimes limited to very simple things. Again, you can see here, if you look at this data issue here, this is an out of context piece of text next to 13 September. Also an out of context piece of text. On the other side, if you look here, you will see it says log category, log date. This is what the screen reader sees. This is what you see on the website. So you could add data that are, not necessarily displayed, but can be picked up by different assistive technologies. And it's not limited to the website. You can take measures to make things easier to find in a search engine. This is an example of that. You had to add data that's not available on the website. You don't find that piece of text on the website. It is there, but you don't see it. It can be interpreted by a search engine and it would be updated. You could tell the search engine when this website is going to be updated. Has it been updated? And all of these information can be provided to make it easier for users to get the information they need very quickly and find what they need. Again, another part of iterative development. This is an example of how we did that. You can see that the parts that I'm showing with arrows, these are what we call thumbnail graphs. They were just there to show you the overall trend, but not for you to gain any information from it. If you wanted more information, you could click on access cases data or whatever data at the bottom, and that would take you to a dedicated page with an interactive graph where you could see more information about it. But we found that people were tapping or clicking on these graphs, expecting something to happen. Nothing would happen at the time, but they were doing it, and they were doing it in large numbers because it gets very red. Look, so it's the same number of, roughly the same number of people as those clicking on the link at the bottom or on the side menu. So we tried to understand why, and we knew why. They were expecting to see more information. So what we did was, it was a very simple decision. We just turned that into a hyperlink going to the same place as the link at the bottom. This is not a major change, but it makes things easier for people to navigate. Don't look at it from the perspective of a 20-year-old using the service. Look at it from the perspective of a 70-year-old with some visual disability trying to use this, and that would make more sense. They just want to get there. They don't want to just go down and look what's there and what the link says, might not be able to see it properly. It's too small for any reason. It's also, we get into user testing here. And user testing is often really not done the way it should be done, in the sense that we put a couple of questions or options in front of the user and say, which one do you like? Which one do you think is nicer? So, I mean, not all of them are done like that, but a lot of them are. So we came up with a method for evaluating which of these, for those of you who've seen this, it's for the vaccinations data on the website. So which of these would be the better option? And most people initially said the double bar, so the one at the top, A. And then I came up with a question and asked them, okay, so we had already blurred the numbers in there. I said, okay, so tell me, what do you think the number is in there? Can anyone tell me what the number would be in there? Doesn't really tell you, does it? It's like looking at a pie chart. Just might look cute, but doesn't really tell you anything. Same with this one. But when you look at this, you could almost immediately tell me what the number is, right? I mean, it's a 10 by 10 grid. If it's 4 plus 3, it's 43%, isn't it? Fairly easy, but you can't get 43% from that, nor that. So after asking that question, they changed their mind. 90% of them said that is the best. So from 60% and 10% for that, we switched to 90%. And the 10%, which was one single person, didn't care. Just said, don't care. So, yeah. Yeah, so it's a journey that you need to take the user on, but without revealing your intention, without leading them to something, but to see which one is actually useful rather than which one looks best. Those are two very different questions. Another thing that we were very keen about was ease of access, which I mentioned again earlier. So ease of access is really important in the sense that you need to, not everyone is able to find everything easily. And you need to be very explicit about a lot of things. That's one of the issues that we had. We had an API, but it wasn't something that was intended to be used by average users. We ended up having a lot of average users. So we designed a new API and we created a new way of standardizing the data that made it a lot easier for people to access. the data. So we created menus that had the last updated timestamp of the metric, list of metrics available for each area and all of those. But at the end of the day, the single most important thing that we did was to have a consistent standard for releasing any type of data. A code that was written in 2020, mid-2020, in R, still works on the data that is being released now on that service. And we have added, well, at the time, we had what, about 70, 80 metrics. Now there are about 250 metrics for over 8,000 locations across the United Kingdom. And that still works. Now, if you want to see why that is important, I suggest you try the ONS API, Office for National Statistics. If you can find the data that you're looking for, which would be a big if, then download it and analyze it. Try finding that data for a different thing, and I can guarantee it's not going to work on the same process that you've written. And that is why most people cry when you talk about the ONS API. Most people who use it start just want to run away the moment you utter the word ONS and API in the same sentence. So it's really important to provide things that are useful to the users. And we got here by talking to users who are using APIs, who are trying to analyze the data or write other applications. Then it's the transparency, which I said, she talked about slightly earlier. And communicating with people is really important. But publication and interpretation are two very different things. When your data needs to tell a story. You don't. So you, as the publisher of the data, do not need to tell a story. Your data needs to tell a story. When you mix publication and interpretation, we all had opinions about the data we were releasing. We all had opinions on what the government were doing at the time. None of that made it to the platform. Why? Because we made a judgment call early on to not publish any sort of interpretation, none whatsoever, because the moment we did that, it would become loudest voices win, which means the minister with the loudest voice would usually win. So once you say no to everyone, that's that. We publish the data. We are objective, impartial publishers of data. You want to interpret it, go ahead and interpret it. The media can interpret it. We had all sorts of, armchair experts who could interpret it. We had actual experts who could interpret it. But we didn't want to do that because that would have, or that could have undermined our impartiality to one group or the other. And we didn't want that. It doesn't matter which group it is, whether I agree with them or not, they have equal rights to this data. This platform was made with taxpayer money, making it public property. I don't have any right to take that away from someone else. So later on, in fact, a couple of months ago, I was in this meeting at the Royal Society for creating resilient and trusted data systems, and they came up with this very nice diagram based on their research, which I can very definitely say that is actually true. The moment you heard something coming out of the mouth of a minister or any public official, was completely distrusted. Everyone took it, as not being serious or, with a pinch of salt. That side, when people with scientific or professional backgrounds started interpreting the data, people took it a lot more seriously, which is why when I was talking to the public, telling them about the reason why data is delayed, they believed me. When the comms were telling them, they didn't. They came back to me and asked me again. I kid you not. The one time that we were told not to publish the data until the specific time was the time that we actually did have interference. So we didn't publish the data until later, and I didn't say anything to people. And everyone knew there was something wrong. And you can see my identity on an association with the dashboard was revealed around about October 2020. So you can see the trust in the service started to increase. It wasn't just me, other people started interacting from the team, started interacting with people as well. And the trust in the service increased. The more we interacted with people, the more they trusted our work. And the last one, the February 2021, that's a survey of 45,000 people. Just not 50 of my mates doing that. Yeah. There is a cost, and it's often overweight with, by the benefits. What I always say is that, you have people, helps people understand these, it makes it accessible to millions and all that. But at the end of the day, we can't really do it all ourselves. Yeah, this is the number of people who visited this service at 4 p.m. You can see it's about 300,000 people on that day, 300,000 requests on that day, probably about 120, 30,000. And it takes a lot for a team to do this every single day. See, our mistakes were published on national broadcast by national broadcasters within minutes, if not seconds, of us making those mistakes. See, that data was released on at what? 1604, 404. It was on Sky News at 1607. And on BBC News at 1612. And they were quoting it wrong. We had a notification in there, they didn't read it, they just used the API. So we tried to alert them, and we created other services for them to get our notifications through the API as well. So it's not entirely their fault, it's not our fault, but we can make it easier, so let's make it easier. It helps us make things easier to, it makes it, you could look at it from different perspectives again. The vast majority of people try to help us. Some of them try to catch us, and some sort of conspiracy or something. But at the end of the day, they're both entitled to the data, as I said. Both are users with equal right to access this data. How we look at it is down to us. We could look at it from perspective of telling them, right, okay, so, it's a mistake we've made. Whether they tell us or the other group tells us, it's a mistake we've made, so we're going to solve it and explain why we made that mistake. It doesn't have to be, again, it's not a zero-sum game. We don't have to be afraid of making mistakes. It's not always a scandal. So what? I mean, it's a mistake. You can improve your standard operating procedures. You can improve your QA system by identifying these mistakes. We're talking about 50 million records being released a day from 1 billion data points. Mistakes happen. You can't QA all of that individually. We improved our QA system. These boxplots you see here, it's one of the things we implemented. It would tell us, you see the dots in there. Some of them are green, some of them are red. It's very small. They would tell us how late or early we are relative to our normal operations for each data. So each of those lines is a piece of data that we've received from one of the sources. So it could be cases data, it could be, I don't know, it says on the side, I think. Yeah, main data, cases data, healthcare data, testing data, all of these, how early or late have we received it on a specific day relative to previous days. And that would tell us how early or late we are, and we could tell people that we're going to be late by 5 minutes, by half an hour today. And these helped. Again, as I said, we can't do it all. So these are graphs created by other people. That's a book written on COVID by David Spiegelhalter and Anthony Masters. And yeah, we could do more if we work together. Other websites were created. This service was the de facto source of pandemic data, so everyone used it. The open source nature of it, helps people create new things and contribute to its improvement. You can see on the side, those are the bugs people identified in different parts of the service. They reported it directly. We resolved it and attributed it to that bug that had been reported by that person, who could then share it and say, I reported this bug, got resolved. And that's how you build trust. Again, another example is people contributed to us. You could see the second dose was being shown as first dose, it's underlined there. And the person went to our repository, corrected it, made a pull request, I reviewed, approved, and sorry. And that was that. And that's how you can invite people to help you. So the conclusion is, we need better agreement, better arrangements, better coordination, and we need people with expertise in handling data at scale, and people with domain expertise. But most importantly, this is my final remark, I'm not saying that nations across the UK are not really going to do anything to make each other look good. But if I was saying that, what are we going to do about it? So, so if I said, the Scottish Health Authority isn't really happy about us releasing the data before they do, because this service is associated with the Prime Minister they don't like or they do like. I'm not saying that is the case, but if I was saying something like that, how are we going to address that? We need to address that. And that's how we make progress. And we try to make these things better by establishing pipelines. We did it during the pandemic, but ideally this should be done before a pandemic. And that's why we are talking about it now. Thank you very much.
Thank you very much. Do you want to sit here, I think? So I think that's really interesting, and I hope that, there's obviously this whole sort of thing about how lessons learned, and I'm just wondering, to kick off the discussion, are there bottlenecks that you could summarize that you think will sort of continue to be relevant, that the key bottlenecks that are kind of making progress in this area that you've sort of, from your experience?
In terms of the specific work that we did, I could give you a very explicit example. I worked as a part of Public Health England, which was the de facto authority for dealing with pandemics in England, at least at the time. And how do you think we were getting the data for cases for Northern Ireland at the time? That this didn't continue. We established better processes, but in the beginning, for the first few months that we were publishing this dashboard, we were getting the case data for Northern Ireland from Twitter, the Twitter account of the Northern Ireland Health Authority. There was no established route for them to send us the data. That was the only way we could do it properly, until we could find someone that we could contact and establish some protocol. And that is really the problem here. The bottleneck is A, with not having things in there, and B, with people who do not have sufficient understanding of what it is they're talking about, trying to come up with how you calculate a metric. Calculation of rate based on, we had different metrics on the website, and one of them was cases by published date. It's not really a very good metric, but people wanted as up-to-date data as they could get it, so we published that. That was basically the difference of cases by specimen date for today versus yesterday. So the delta of the sum of yesterday versus today would have been the number of cases by published date, right? So how many new diagnoses have been added and they were not all, the results were not being all published on the next day, which is why we had this metric. Except somebody somewhere asked, we need a rate of this. I mean, what does that even mean? You're talking about the first derivative of the delta of something. That makes absolutely no sense. And they're pushing for it without knowing and understanding it. And these are the things that, this is not something that needs to be handled at the level of Secretary of State. We have a head of profession for statistics for exactly that purpose. We were sorry, communicating with the Statistics Authority of the UK for that purpose. So the roles need to be defined as well.
Great. Yeah. If I can follow on from that,
the pandemic was an exciting time from a data perspective. First of all, government was interested, which it hadn't been for quite a while. And then you started, amongst others, bringing all of this data together. But it highlighted what was possible, but also where some of our deficits were in population health statistics. And you talked about rates, but one of the things for rates is you need a denominator, and oftentimes we don't have accurate denominator data. So for example, it highlighted for me anyway, that we didn't actually know how many people were in the country and by age and sex. At one stage, I know that Ireland produced 103% uptake of vaccine.
Yeah.
And they're over 85, because we're just not sure how many people are of that age there. Secondly, we weren't sure, and we're still not sure, how many people are resident in care homes, which is a bit of a shameful thing, I would think, for a country to say. And the third thing is that when we came to talk about ethnicity, data weren't there as well. So what can we do going forward to help plug some of those gaps?
It's a very, very good and very difficult question to answer, really. We have two established denominators in public health. One is the one that is released by the ONS and is updated based on estimates they make relative to the census each year. So there's one, which is that. There's another one which is called the NIMS, which is for immunization denominators. And that is based on the number of people on the vaccine register, actually on the register. So you could argue that the NIMS denominator is probably slightly better for this purpose, for the purpose of, calculating, say, vaccination uptake. But there is a problem with that also, in the sense that, people who leave an area, they don't necessarily call a GP and say we've left, right? And they might still be in the UK, they're just not, say, in Cambridgeshire, where we had a denominator that was substantially larger than the population. And there isn't really much we could do about it. Our argument was sort of valid, that this is the basis of supply. The NIMS denominator is the basis of supply. So it should, the results should be calculated on the basis that you're calculating the supply. But it's not always going to be correct. So what we do need is to have uniform data collection and data processing systems, which we really don't in the NHS. I mean, they're trying to make a few, but we don't really have that uniform system, certainly not at the UK level. But we are trying at different nations in the UK to create something like that. We also need to maintain some degree of communication with these patients. We don't know if they're alive. We don't know if they've left the country. Where are these people? You just register and then disappear. So that might probably be a better way of calculating. The ONS denominators are pretty accurate, mind you. They're very, very good, but not if you're calculating something with that level of accuracy for something like vaccinations.
Thank you so much for that. It was great. So I was on SAGE and co-chaired SPI-B. So there were a few things that you talked about. So one, the amount of work you did, we all used the dashboard loads as we were meeting on a daily basis. But I think there are a couple of things your talk highlighted to me, is sort of the social political context of data and trust. So SAGE published all of its minutes and papers, which is really, really unusual for an advisory group or government committee. So you had both the push for open data, but the push from the scientific community for it to be open. And I think those are the areas where you saw trust in what was a really polarized debate. Two, the devolved nations is really interesting because I'm Wales based, so I was also on the advisory group in Wales. And I guess health is devolved. And that trust and data pipeline work has to come through that political acknowledgement, isn't it? There were lots of tensions. And then the first question I had for you that I was coming to last was, so I think the open data debate that arose through COVID was absolutely beneficial. Do you think the very polarized scientific debate, so you had scientists who were very vocal on Twitter, arguing on both camps, vaccine, don't vaccine, mask, don't mask, COVID exists, COVID doesn't exist. Do you think that was helpful?
I do, yes, I certainly do. I think the more debate we have, the more people are able to put forward their arguments, and you could, evaluate and criticize those arguments in public in the same way, because once you utter that argument in public, you are subject to that type of criticism as well. And the fact that we talked about it, we raised awareness, and that raising awareness, I think, is always beneficial. I'm a huge fan of education, and I'm not a huge fan of traditional education that you see in the class. I always had a bottle of water under my chin in my university years, just to look like I'm awake. I never was. Didn't listen to one single word of lecture in my entire education, not once. I also lectured after that, and I tried to make a difference in that. But the point I'm trying to make is that the debate, if we promote debate, people will try to read things and learn things. It's not always right. And again, you do fall into that rabbit hole of, who has the loudest voice. But at the end of the day, you raise public knowledge, and raising public knowledge is beneficial. Majority of the people in this country got the vaccine, didn't they? Despite all the things that were said all over the world, majority of the people got the vaccine. Majority of the people stayed at home. Majority of the people wore masks when we're asked. Why? Because they had access to both sides of these arguments. They chose to go with the one that had more knowledge about it and had the authority about it. They didn't necessarily agree with it at all times. Not always 100% agree with it. But if you don't need to agree with something 100%, if you agree with it at 51%, you would still wear that mask or try.
What's interesting with vaccinations is that at the beginning, we saw real definite inequalities in uptake, didn't we? In populations predominantly that didn't have trust in government, so ethnic minorities, people with mental health conditions. But towards the end, that was all addressed. So whether that was all part of the same movement towards trust.
The fact that we noticed that and talked about it was because we had the data in front of us. We saw that people, different ages, with different ethnicities, were receiving different amounts of information and different uptake of vaccine. So
it's the first time my family has known what an epidemiologist was. So happy days.
Same thing. Yes. So just a final question. Oh, sorry, is there another? Oh, I think we might be needing to wind up, if that's okay. I was just going to ask, because a lot of early career researchers in the audience here, it's slightly cheeky, but how did you get the gig, as it were?
Well,
how does one become, lands in that position? I mean, obviously, I'm assuming it wasn't a sort of long interview process. It was all rather urgent.
I was at the time the principal software engineer at UKHSA, and then the deputy head of software engineering. So the way I did it, well, I mean, again, I have a very extensive background in software and data, but I went from academia to UKHSA, or PhD at the time. And one morning I had a call. Someone said, okay, the NHS have created this dashboard, the first version I showed, small one, but something resembling a dashboard with 4 pieces of data on it. They don't want to maintain it. Would you accept that? I said, yeah, fine, but as long as I can make it open source. And they agreed. So I made it open source and I took responsibility for that. So I then became the technical lead. I started working with people in health protection, and so the head of indicators at PHE, and the head of profession for statistics. And we started making iterative improvements in this. But the way that this whole thing became as popular as it did, it's because the government didn't want to continue the daily press conferences, if you remember, by mid-June. So we got notification that they want to stop that, and they want all that data to be presented in this dashboard. And you have, what, 2 weeks to do that? Right, data that we didn't have, we weren't receiving, with 2 weeks to create a system to present it. So yeah, I sat down and did that myself. Didn't really have a team at the time. We didn't have a budget for it, nothing. Just sat down myself and did it. Didn't sleep for 3 days. And we published it.
Oh, yes, it's going as
yeah, they kept saying that. Yeah, I made sure I didn't declare that. Yeah, but yeah, so and then Boris Johnson decided that it was a good idea, without telling us, to just tweet the URL, the link to the website. So he did, and I just realized that he'd done that because I saw a massive surge in the number of requests going to the service. Thankfully, I'd made it fairly resilient, so it didn't go down. But yeah, I don't think they ever got that. You really need to coordinate with people when you do these things, so they're ready. But there we go. But yeah, there isn't really established path. It's, unfortunately, there should be. And I've always recommended, I think as a part of my slides, I usually say as well, I think we really need an institute for data science that's not the ONS and is not headed by Ian Diamond. Because everything statistics is now headed by Ian Diamond in this country. You need something that's not headed by Ian Diamond and has expertise in handling a lot of data with domain expertise. That's not the ONS. ONS is really good at what it does, but it doesn't do large volumes of data and publication of them. You need something like that at the national level with authority to request data.
Thank you very much indeed. Thanks.
Thank you.